Welcome back to Your Issues Live. Tonight we come to you live from Old Harbor, part of the cross-country thing, you know. So we brought out the program for a special run. And it's not in need of any evacuation here, if you may, but we're talking about an offer that maybe you can't afford to refuse. It being affordable, as I understand it. Just before the break, we mentioned that it, you know, if you're a member first person, you can move out of here, $500 per month per member, and yes, has to be you. You can't lend it to your sister or brother. And Jamaica being a hub. So people who need medical care, for example, in the Caribbean, can come here or elsewhere in the diaspora. But what kind of a charge would that be to them? Would it be the same $500 that I can tell my mama, say, come on home, you can get that hip replacement finally?
So in essence, a member first member that lives in Jamaica, when they need to go for a procedure that's not available here in Jamaica, that flight is no charge. If you're in the diaspora, you still have access to our affordable health care. We've got 50 centers of excellence around the world in the United States and in 10 other countries. And if you want to have access to those facilities, you will. But it would not include air ambulance cost.
Okay.
But we will do elective types of procedures for people, and we will bring people home on a discounted basis. So you're not paying retail for healthcare, and you're not paying retail for your air ambulance in those situations where the air ambulance, the free air ambulance would not apply.
Well, certainly one of the questions, the first question that's come through, I bet you can't tell me what it is. All right, don't, visas. Ah, there you go. Everybody's bouncing their head. If I get sick and I'm this average Jamaican guy and I've been paying up my thing and I've been good and I've got all my receipts that I pay it, I guess I don't have a visa. Can I still go, Mr. Boyes?
Yes, absolutely. There's a process like anything else, and it has to be substantiated with the proper medical records and the necessity, but people are compassionate. We've never been denied an emergency medical visa in a situation.
It was made a country-to-country situation, so we're not thinking about Jamaica to the U.S. But what of other countries? Do they still have that? Do they also have that compassionate thing that if you show that this person is in need, they can get to that country? What's your experience?
I've been doing this for 20 years. I've never come into a situation where it's been denied.
But it is not a visiting visa to shop or anything. It's to go take care of your medical stuff.
No.
See, I'm saying this because I know what some Jamaicans are thinking right now. You know, let's get sick.
Again, the assessment is made from a medical standpoint. So our medical director would intervene and collaborate with the other physicians to make the proper assessment.
What happens, though, when you get overseas? You land. You tell me there are centers of excellence. What happens overseas, wherever overseas is?
Again, you prepare for the emergency will cease to exist. When that phone call comes in and we have to respond at that level, it happens fast. It's seamless. As soon as the doctor says, boom, go on, the ground ambulance on the other end is going to meet the plane, take the patient from the point into whatever medical facility that is the receiving facility. Our patient member advocate has arranged it, orchestrated the whole thing, and manages it through the whole process.
Help me with along the way. I mean, I landed the patient before I found out about what was happening in the plane there. Well, how is it hooked up? I mean, you know, is it a hospital you have in the plane, or?
Depends on the level of response. Yes. The inside of the plane is a hospital, has a lot of equipment, and the technicians, the EMTs, the nurses, if necessary, the physicians that are on the plane are specifically trained and qualified to respond to an emergency on the plane.
Let me get back to this one, Miss Mighty. I'm still running through my $500 per month to get on a plane and over there. How is this really workable, Mrs. Mighty? Tell us it's a joke.
No, it's not a joke, and I really want to emphasize that it's no joke. It's real. And as John said in the earlier discussions, it is made so low because it's going to be driven by volume. So for this program to be really successful, for the fund to really have funds sufficient to carry this program, we need tons and loads of people to join. And that is what is driving the price. This could have been priced more expensive. We did various scenarios. We had actuaries who looked at the whole product. And we said what we want it for is for the members who really have it hard when they have an emergency to find the kind of health care that we can't find in Jamaica. And
Right.
so we worked a program. I mean, we wanted it lower, but at the end of the day, what can make it work? But it has to be driven by loads of members, hundreds of thousands of members
Coming on board.
coming on board this program.
Let me ask this question because I don't want our viewers to be confused. We're talking about an air ambulance service. We're not talking about insurance, as you mentioned, but we're not talking about free hospital care, are we?
No.
No. Exactly, make the distinction for me. Why is it still a benefit, as you argue, to use JamaicaMed?
Well, in essence, if you need an air ambulance service, generally speaking, here in Jamaica, you'll see retail prices for air ambulance in the $25,000 to $30,000 range.
That's Jamaican dollars?
That's U.S. dollars.
Okay, just making sure we're on the same.
It's U.S. dollars. 25 to
25 to
30,000
30,000
U.S. dollars.
One way, two way?
That's one way.
It's the only one way.
That's
Only one way.
Right.
And you're offering a service. Now let's look at what you're doing. You're offering a service for 500 Jamaican dollars.
That's correct.
After a period of time.
There's a 6-month waiting period.
You have to wait for 6 months. I want
Right.
Jamaicans to understand clearly what is being said here.
Right.
You start paying your $500, you become eligible after 6 months. But here's a trick. I know I would have found you out. $30,000 would make me get some free hospital care, though.
No.
No.
If you may remember, there was a prominent politician some time back that had to go, and they wanted money up front for the air ambulance, and they wanted money up front for the hospital
So
care.
that's separate money, different money?
It's separate money. And in that case, it was retail pricing. In the United States, a heart bypass retails for around $150,000.
How much can I get it for?
Well, it depends on where you go. We have different cost centers that have outstanding outcomes, but you have to fly maybe a little further.
Okay.
So we have
Same
really,
$500 though?
we have two levels. We have two levels of care. We have emergency and we have elective. On an emergency basis, you still have to pay for the health care. It is not included. This is, again, not an insurance. We will take your existing insurance, or we will help you arrange for payment in a variety of ways. We're starting to work, like for example, COK can arrange for loans and that sort of thing to help pay for the healthcare cost. But when you have a situation where you're paying retail instead of maybe 25% under retail, retail's not reachable. When a discounted price comes in, then it can be reachable. And in some of our facilities, you could get a heart bypass in the $12 to $15 or even $20,000 range.
And with a little help from some good family members overseas, maybe we can work it out.
And many of these facilities are, most of these facilities are run by people that have been trained in the United States with doctors that are trained in the United States, state-of-the-art technologies, and outcomes that are better than what you find in the United States. Many people don't realize that the United States, according to the World Health Organization, is number 37 in the world in quality.
Wow, 37.